Women make up 70% of the healthcare workforce, but only 20% of its leadership. On Her Story, we'll explore the careers of bold and influential women from Silicon Valley to Capitol Hill and learn how they've overcome the odds. I'm your host, Sangela Jane, and this is Her Story, a program where we explore what's beyond the glass ceiling. I'm delighted to welcome Solomé Tibebu, who's the director of the Upswing Fund and a leader and champion in the behavioral health space. Solomé, welcome.
Thanks so much, Angela.
So great to have you. You have just been an incredible pioneer in the behavioral health space, and I didn't even do your introduction justice because I think you have, I don't even know, like 4 or 5 different hats that you wear. So excited to dig in that with you in a little bit. But tell us, where did the interest and the passion for behavioral health actually start?
I had really bad anxiety and obsessive compulsive disorder issues when I was younger as an adolescent. The anxiety was just so overwhelming, panic attacks on a regular basis in middle school, running to the counseling office several times a day. And then the OCD was really challenging because still today, OCD is so misunderstood. And even at the time, I didn't know what I was experiencing. So you can imagine how challenging that was for me to even share that with parents or other people who could help me. And so it was challenging to manage it, and it was a really impactful part of my life. And so that's when later in high school, as I was trying to figure out resources online just to find other teens like me who were going through what I was going through, I wasn't able to find much. So I decided to create that resource myself, which I creatively named anxietyinteens.org.
You got an early start from this personal experience. You and I have chatted a lot about kind of the stigma that's associated with this, particularly at that age. Tell us a little bit about kind of how did your family factor into that? Were they supportive of this? How did they get you the resources that you needed at that time? What was that process like?
Like I said, I barely had the vocabulary or skills to articulate what my thoughts, feelings, and behavior was all about. And on top of that, my father's from Ethiopia, my mother's from Poland, and after we started talking about OCD and learning more about what it is, they said they couldn't even think of what the alternative for OCD would be in their languages. So lots of challenges, and mental health wasn't really something we talked a ton about at home. Trying to navigate services and finding the right treatment, that was especially challenging because of course, my parents did everything in their power to try to help me. We tried our best to find several therapists and different kinds of medications. But with each one, I thought, wow, this must be as good as it gets. I've already tried that and that, but still it wasn't very good until I finally saw my 4th therapist and my 4th or 5th medication. And that was the perfect combo to actually help me manage my symptoms. And so if there's anything that I could say to anyone who's listening, these kinds of challenges are hard to manage, no doubt, but they are very treatable and manageable. It just takes some trial and error to potentially find that right mix.
I think that's so powerful because it sounds like you've really dedicated your career to making those resources really available and accessible and kind of helping educate really I don't want to say the market, but really our community at kind of all levels on, what it takes to kind of manage it and that you can be supported. I know the first time that we met, I was struck by the fact that you are just so passionate about what you do, and you really are this doer, and you're just kind of just so committed to the cause that in many ways I wonder, at what point did you start viewing yourself as an actual leader? And when you think about the various roles that we'll walk through in a second that you've held in your career, do you view your entrance into that kind of healthcare leadership space as more accidental or intentional?
I'd say I still definitely struggle with this idea of saying I'm a leader in any kind of space, but I guess if there was one that I had to pinpoint, it was actually right around college when I was invited to give a TEDx talk about my story and anxiety and OCD. And I remember getting that invitation and how exciting that was, but also working with the curators and collaborators of what am I going to talk about? Who am I to talk about this and tell this story? But they were actually the ones to really empower me and say, there are plenty of very clinical sessions and content online, but apparently my story was a bit unique in that I had this personal journey and took that and took action on creating resources around it, and that alone is something that others could potentially glean from, and it really motivated me to say, yeah, I mean, if I can do it, then anyone can. So why don't I use this platform to present that?
I think at the heart of what you're saying is there's a little bit of this misnomer of, what exactly is leadership? And, we all have our opinions on that. But at least for me personally, I think it's a lot about having influence. And that's exactly what you have had through sharing your story, from the early days on. So kudos to you for having the courage to do that, because that's really not easy to do. So I want to take a step back then and kind of from anxiety in teens, you kind of started that very early on to now you're at the Upswing Fund. You grew up in Minneapolis, which is where you started anxiety in teens, and have through many different routes have found your way out on the West Coast now into San Francisco. What was that path like? What did you do after anxiety in teens?
Yeah, who would have thought that I would still be involved in behavioral health? I definitely did not think much about that when I was 16 and started anxiety in teens back in Minneapolis. But I continued that online resource. We did all sorts of peer support activities with students nationwide. We did events nationwide. And so that really piqued my interest in technology, mental health, entrepreneurship. And so when I went to college, I decided to be an entrepreneurship major, in which case my parents said, "Excuse me, a what?" But I knew that that is what I wanted to do, and around junior year, I got another idea, which was basically a mental health tech startup that would provide online CBT exercises for adolescents and adults and analytics for providers. And by analytics, I mean like some very lightweight dashboards. But so yeah, 20-year-old me started this startup and got a little bit of seed funding, found the clinicians and programmers, and we built the thing and worked with some local partial day and residential programs. And it was an amazing experience. Ultimately, 20-year-old me did not know what all goes into launching an enterprise healthcare startup, so it ultimately didn't pan out, but really great experience. And now, over a decade later, there's like a million of these things, and it's just amazing how the entire behavioral health tech space has really exploded. So that was the next chapter. After that, I decided to move to New York and started working for the largest behavioral health EHR software company, and had an opportunity to sell all sorts of ancillary products, patient portal, RCM, whatnot, to psychiatric units, IDD, foster care, substance use. Learned something about working at a real job and healthcare. And so that was a really great experience. And then after that, my next move was to San Francisco, where I worked for some startups and venture capital funds investing in digital health broadly.
So you would know these numbers better than I do, but the last I remember doing some work in this is, what is it, about 1 in 5 kind of Americans struggle with a behavioral health disorder. I know within adolescence specifically, that number is even different. How does that trend reconcile with the national trend?
Yes, absolutely. That is correct. And yeah, and on top of that, the pandemic has just emphasized how much more need there is to offer mental health services, emotional support services for adolescents and adults across the country. And so that's why I'm thrilled to have the opportunity to now lead the Upswing Fund for Adolescent Mental Health, which is a philanthropic collaborative fund that supports organizations who are either providing mental health and emotional support services to specifically LGBTQ adolescents or adolescents of color, or they're national nonprofits that you could think of as systems enablers that are really transforming the entire ecosystem for mental health, specifically for adolescents.
And so when you think about the ecosystem, I mean, you mentioned this earlier. I mean, over the last, decade or so, you've seen this tremendous kind of movement and progress, so to speak, in more investments and more companies really focus on behavioral health, which wasn't exactly the case at the time when you were starting to think through this as a young teenager. What do you think has ultimately moved that needle or created more attention, or these platforms like the Upswing Fund, where we're actually focused on some of these issues that have persisted for some time, but we're really now starting to see some traction?
Totally. There's so much more funding and attention, and I mean, behavioral health is on the mind of everyone now, which is great, and I hope continues. I think a lot of what has fed into that is consumer sentiment, this next generation, and as they have begun to enter the workplace, they even expect those kinds of benefits to be there. And so I do see a lot of employers investing in digital behavioral health solutions as a result. Additionally, the connection between behavioral health and physical health, anywhere you look in any kind of healthcare publication, health plans are talking about how the impact of behavioral health or how they're providing solutions for behavioral health are impacting a lot of, quite frankly, expensive physical issues. And I think that's only driving further investment to want to adopt behavioral health solutions. I think it's been common sense for a long time, but now there's a ton more data, and behavioral health startups are adopting measurement-based care type of, how should I say, solutions internally baked into their products that they're better able to demonstrate that they're providing those cost savings.
I mean, I think that's really powerful, right? I mean, the data has helped catalyze a bit of that movement and has held us all accountable to, can actually see if we're making progress or not. From, my limited knowledge of this space, you're in the thick of it every day. A lot of it has been focused though on let's say kind of older adults, or just the general adult population. And I think what's so unique about your vantage, both at the Upswing Fund but your own experiences, really is in that adolescent population. Talk a little bit about kind of what are some of the differences that you see in terms of, the approaches that work for really making resources and care more accessible to that population. What are the things that we have to do differently? What are the things that we get wrong about that population?
Wow, where to start? I mean, young people, they have a much higher bar for user experience. So much more thoughtfulness around how we're designing products specifically for them. It either has to match the experience of a lot of the big tech social media companies that have invested millions and millions of dollars in their UI, or they actually have to be embedded, or we have to think of how we're actually leveraging those social media platforms to reach and engage adolescents, which is a tricky thing because depending on the situation, social media is oftentimes part of the problem with mental health issues. I can't even imagine, thinking back as an adolescent, it was like, oh, who is on AOL Instant Messenger? And all of those three girls just logged off at the same time and no one replied to me. And now with Instagram, it's just like magnified all of the different directions it could go. But to leave it more on a positive note, there's also so much more advocacy happening on these platforms. Youth are finding their voices, finding their ability to share their stories in a much more scalable, interesting, and engaging way than certainly I did on my forum with anxiety in teens. So that's one positive aspect. I will also say it can be difficult to develop tools and online resources for this population, just given different consents that are required, COPA laws and whatnot for what you can do for 13 and under year old. When do parents need to sign off to be able to connect young people to services? So there's more aspects to think about.
Did you ever envision, 16-year-old Solomé, started anxiety in teens, that one day you would be running this, national fund that's affiliated with, Melinda Gates and her foundations and exclusively focused on, adolescent mental health? I mean, did you ever envision that?
Definitely not. In fact, the only thing I can think of is in Mrs. Kane's classroom, we were talking about what we would be doing by the time we were 25. And I think my three things were I was going to be a famous gymnast, Mariah Carey and live in New York City. And so I only achieved one of those things by 25. So
Well, it's not too late to cross off some of those off
it
your
definitely
list.
is. No one wants to see any of that.
I don't want to gloss over that. I mean, that is really a really big accomplishment, to have this, significant role doing this, significant work. How surreal was it? What were you thinking at that time?
The Upswing Fund for Adolescent Mental Health is seeded by Melinda Gates' personal investment and incubation company, Pivotal Ventures. They do, of course, a ton of philanthropy, but one area that's been a major priority for them for a long time has been adolescent mental health. And I've had some exposure to some of the organizations they've worked with. I've been an advisor several years now for the Telosity Fund, which is a venture fund investing in youth mental health and well-being startups. That's also funded by Pivotal. Same thing with the Headstream incubator that incubates earlier stage adolescent mental health and well-being startups, digital well-being startups. It was around a year ago now. I was,
Hmm.
just as I am now, in the thick of planning my Going Digital Behavioral Health Tech conference. And I think Pivotal had reached out. We're like, oh, we'd love to talk to you. We've got a juicy idea. And so I got on the phone with them. And of course, I was just totally overwhelmed to hear that they wanted to, especially as a result of the impacts of COVID, as I said, how much adolescents have been struggling, specifically underserved populations like LGBTQ youth and youth of color, to carve out this fund. Of course, I was elated to have the opportunity to accept that invitation.
You're right. You're coming up on kind of the 1 year anniversary of that role. And, back to where we started, you're in this, let's call it formal leadership role now, of where you're now really scaling a lot of the work that you have been doing for so long. What has been the most rewarding part of kind of the work that you've been doing in the last year? And then I'll ask the flip side of that, which is what's been the most challenging?
After standing up the fund, announcing the two RFPs, for one for direct service providers, the other for system enabler nonprofits last fall, reviewing hundreds and hundreds of applications, and then finally announcing our portfolio recently. I announced we have 88 organizations nationwide, an amazing mix across the country, different geographies, diversity of populations. One thing I'll say is we took the approach of funding a variety of really different organizations. So everything from larger mental health nonprofits that are more established and might have more immediate reach and scale to impact adolescents quickly as a result of the pandemic, to more emerging organizations that, oftentimes we were the largest funder to help them get to that next level. And that latter group is what was really exciting for me. It was a subset of organizations that were LGBTQ or BIPOC led, who really understood how to engage and reach the population we're trying to reach in their communities. But they themselves, they're very mission driven, oftentimes underfunded and really unseen. And it was really exciting to have the opportunity to be one of their largest funders. And so for me, I think I'd say one of the most impactful things is being able to play that role. And I'm excited to learn what we can do to continue scaling their work, because they really are a reflection of the population they're serving, and that's really important.
If you were to think about kind of the last decade or so in behavioral health, and you've kind of seen this progress, and there's a lot more funding and companies like you mentioned, what are you most excited about for the next decade? What are you hoping that we kind of as an industry can really move the needle on?
You can make the same analogy for-profit startups, and you've seen the statistics around how many venture capital dollars are going to BIPOC LGBTQ founders. It's the same thing. If we're talking about really serving the most underserved, who have not historically had access to behavioral health services, we need those to be the leaders to actually develop and scale those solutions. So This last year has been a very challenging one in terms of all of the racial injustice that's been in the news so frequently. But I do hope at least it seems like it's a catalyzing moment for a lot of companies, philanthropists, funders of all sorts to invest in the next generation of leaders that I'm talking about.
Well, so speaking of leaders, so in addition to the Upswing Fund, you wear many hats. I know you write this newsletter, you're planning this big behavioral health conference, you sit on a number of boards, advise companies. I mean, oh, you do so much. I don't know when you sleep, but, taking all of that in aggregate there, at what point did you kind of realize that your leadership journey was going to be different because you were a female?
As a woman of color, as a younger woman in a lot of the settings that I'm in, it really goes back to I have a unique perspective. And, even talking about the Upswing Fund, I don't really think there are a lot of the organizations that we funded, they probably don't have a lot of funders who look like me either. And so, thanks to Pivotal Ventures to have that kind of outlook, I know that's an important aspect for them. But it does feel like a lot of pressure too, and I definitely hope I don't continue to be one of the few that have that background, but it's important.
It is. I mean, I think that was one of the things that you and I got to bond over, right? It's so rare to meet not only women of color in these leadership roles, but also in a certain kind of age bracket too. And I think there's probably a lot that you've experienced along the way of either being challenged or not taking seriously. Like tell us a little bit about kind of what were some of those moments where because of what you represented, kind of demographically, that it posed, additional challenges that you had to overcome.
In a lot of the work that I do with different companies, whether they're early stage startups or more established health IT vendors, I've had an opportunity to consult many of them over the last several years. And I think early on, a lot of the questions are, okay, you don't have a very traditional background in consulting or any kind of fancy MBA or anything like that. But I think once we get into it and I talk about the real world practical experience that I have working in, starting in, co-founding these kinds of companies, and also my own personal experience using these kinds of tools, building them, that really at the end of the day is what's most relevant for them oftentimes.
And, speaking of that kind of village of people, what role have mentors played in your journey?
I have had an overwhelming number of amazing mentors from so many backgrounds, starting from when I was starting my startup early on back in Minneapolis. None of it would have happened had it not been for the support of more established healthcare entrepreneurs to show me the ropes and help me navigate. And still to this day, that's absolutely the case. And so I think looking back, one thing that college Solomé probably did a good job of was really networking as much as I could, not really knowing what path or where any one conversation might lead to, but oftentimes it was better than expected, and that's still something I do a lot today.
It always works out that way, doesn't it? I mean, I think what's interesting though is, it's great to have that network and have so much support and, all those different colleagues and mentors often share, great pieces of advice, but you're also kind of working through things that had not been done before. And so I guess the question would be, is there a piece of feedback or advice that you've, kind of received along the way that was either really difficult or you kind of just didn't agree with? Anything to that like?
Oh, I love that you pointed that out. Totally. Yes. I mean, whether it was for my own venture or even testing out some new things with the Upswing Fund, yeah, I think half the battle is even acknowledging that no one has really done some of these things before. And especially as a younger person in entrepreneurship or any field, of course, it's important to have humility and listen to people who have gone before us. But at the same time, no one's perfect and no one has all of the answers. And many people are pretty eager to give a ton of advice. And so it's just also standing strong in your own conviction. And that's something I've struggled with, but it's evolved and improved.
And so, is there kind of a trade-off or a sacrifice you think that you've had to make in your life, personal or professional, kind of along the way that's, allowed you to do all the things that you do today?
Yeah, I definitely have no idea what's going on in pop culture, like at all. So I've got a lot going on, a lot of interesting projects. As you can tell, like kind of want to pursue all the things, but yeah, certainly that means missing out somewhere else. You can't do everything all at once.
Hence the Mariah Carey goal by 25. Okay, this all makes sense.
That was a good one to let go of, for sure.
Do you have any, like fun rituals or things that you do for you, that's kind of like your timeout thing or way that, makes you, more productive in a day, whatever that is, ritual or hobby?
As I have gotten older, I've recognized how important that is. Not just because, oh, exercise, diet, whatnot, but really more personally for me, in terms of my anxiety and OCD, it's become quite apparent that when I'm not managing all of the lifestyle pieces, it's just perfect breeding ground for that kind of anxiety and OCD to flare up significantly. And so, like when I was younger, after I found the right therapist and medication and whatnot and had my routines going and really was managing the OCD quite well, it was like, oh, wow, I overcame it. Why don't I go give TED Talks and, speak about it and blah, blah, blah. And then after a few years of starting to let some of those habits, healthy habits, by the wayside, it was just like perfect storm for the anxiety, panic attacks, and OCD to come back full force. And that's when I kind of recognized, oh, well, this isn't really something I overcame. This is something I'll be managing for, who knows how long. And absolutely having those ingredients in peace, the running regularly, sleeping, proper diet. I'm being a total hypocrite this week, but typically they're on point and it's actually quite important for me.
I mean, I think that's a really good reminder for all of us, though, because in some ways it's not I guess for lack of a better term, it's not like a checklist item, right? It's an ongoing self-management, self-maintenance thing. And there are, days and weeks or months where sometimes we kind of deviate from kind of our norms, but it takes a lot of work and practice at it. And you have to keep, investing in and doing those things. So I think that's a really, really good reminder for all of us. I guess if you think back to then, younger Solomé, whether it's 16 and when you're just starting off and kind of taking on this work, what advice would you give to your younger self?
Yeah, it would be to pursue these open doors, these interesting opportunities, like sign up for that business plan competition or go to that summer camp, because that's where, sitting in a bunk bed at summer camp is where I thought of the idea for anxiety in teens. And who would have thought that the submission to that business plan competition is what would evolve to my startup, to entirely leading to a career in behavioral health technology. And so having the opportunity to explore different things, if you have access to them, take advantage of any kind of opportunity that comes your way.
That's great advice. And, I think you have so many more chapters to write in your book and you're just kind of getting started. But I'm curious, when you think about the legacy that you'll leave behind, as this healthcare leader, what would be the title of your autobiography?
Well, I definitely hope that it is expanding access to mental health care. There's a lot of really interesting technology and innovation, but innovation for innovation's sake is really quite pointless. What really matters to me is that, if there's a family like mine with a young child with immigrant parents who don't know how to access or navigate where to get the best mental health support services for their youth, I mean, that's the kind of thing that I absolutely want to transform.
I think you're already doing that. So thank you for all the work that you're doing. In some ways, I think you're too humble to brag on yourself. And so I just want to kind of, on behalf of our audience, like really just thank you for, the incredible work that you have been doing really from day one. And, behavioral health, generally is a really difficult issue to tackle for so many reasons. But I think on top of that, you're really getting at it, particularly at a subgroup population that, a lot of people weren't really thinking about. And so I think you've really, through the work that you've done thus far, have started to bring more visibility into, the adolescent sphere. And we're really excited to see what else that you're going to, take on in the years to come. So thank you, Solomé, for spending so much time with us today. It's a really incredible story, and congrats to you for all the work that you've done so far.
Thanks so much, Angela. Really delightful speaking with you.